What can I expect after a hair transplant?
Men who undergo hair transplants are often less than satisfied with the results from their procedure. Many people believe that a hair transplant can be a permanent solution for genetic pattern hair loss, particularly after having had just one procedure. I'll discuss my approach to hair loss in men and women and how I counsel my patients in regards to the potential impact of hair transplant surgery in a typical individual with genetic male or female pattern hair loss. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been performing hair transplant surgery throughout my career. I'm also the founder of TrichoStem Hair Regeneration Centers, a highly effective non-surgical treatment for genetic pattern hair loss for men and women who come to us from around the world. This treatment was developed from our application of advanced wound healing technology to help improve the results of hair transplant surgery. Based on the effects seen on thinning hair, I created TrichoStem Hair Regeneration as a standalone treatment that has effectively become a welcome alternative to hair transplant surgery for men and women who want to optimally manage their thinning hair issues. Many people about to get a hair transplant or who just had a hair transplant think that ongoing progressive hair loss is effectively treated by a single hair transplant. Hair transplant surgery does not treat progressive hair loss at all. A hair transplant involves harvesting hair grafts from a permanent zone, which is a band of hair at the back of the head that are genetically resistant to hair thinning, and transplanting them to an area where hair has been lost. This process does not prevent progressive thinning or future loss of the native hairs in the scalp. The initial results after a hair transplant can show improvement. However, as time goes on, native hair continues to thin and without further treatment will disappear as genetically programmed. This behavior is often what leads to the appearance of visible hair plugs, where only transplanted hair remains after native hairs disappear. There are two challenges that every hair transplant surgeon and patient has to deal with. One, achieving the appearance of natural density. Two, maximizing the survival of the grafts transplanted. Natural hair density ranges in individuals from 50 to 100 hairs per square centimeter, with thicker hairs providing more scalp coverage than thinner hairs. To ensure graft survival during hair transplant, the number of hairs transplanted per square centimeter is about 20. Exceeding 20 grafts per square centimeter puts survival of the hair grafts at risk, as there may not be adequate blood supply to support of the survival of too many transplanted grafts. With safe hair density being limited in each transplant session, it's important to know that it may take more than one hair transplant procedure to get closer to natural-looking density. Graft survival is perhaps the most important limiting factor in hair transplantation. There are only so many hairs in the permanent zone which can be transplanted. Of the absolute number of hairs transplanted, a percentage of the grafts do not grow. For example, a popular hair transplant surgery such as FUE or follicular unit extraction, in this procedure up to 30% of hair grafts can be lost just from the process of harvesting, which results in something called transection, or dividing the graft in a way where the root remains behind while the hair is placed. Even with intact hair grafts, survival can be unpredictable. Patients have come in who have had procedures such as megasessions, and have lost 90% of their hair grafts. It is with the intention to improve hair graft survival and donor area healing that led to the application of advanced wound healing materials such as extracellular matrix or acellular matrix. This did result in better graft survival and improvement in the donor area healing. It was during this time that we observed that native hairs, which were not transplanted, grew thicker. This hair thickening effect was seen about a year after the transplant was performed. This effect on the existing hair inspired me to pursue the potential of acellular matrix with PRP for the treatment of hair loss without hair transplantation. I theorized that thickening existing hair and increasing the number of existing hairs will result in greater hair density and volume in comparison to hair transplant surgery. Over time and continuous review of the results of treatment, I created algorithms to customize the treatment based on a person's hair loss profile and created TrichoStem Hair Regeneration. When a person comes to our practice with hair loss, I determine if the hair loss management strategy is best approached with TrichoStem Hair Regeneration or with hair transplant surgery. In practical terms, if you still have a reasonable amount of thinning hair, it makes sense to use a non-surgical TrichoStem hair regeneration treatment to maximize coverage before considering hair transplant surgery. If the scalp, for example, in the front is smooth and has been smooth for 3 years or longer, the likelihood of hair follicles being present is relatively low, which makes this person a better candidate for hair transplant surgery. I recognized that the overwhelming majority of patients who come in for hair transplant surgery consultation are people with thinning hair, not smooth scalp. In the past, hair transplant was the only option for many people. Now, with TrichoStem hair regeneration, the majority of people are satisfied with the results and actually don't end up getting hair transplant surgery. If you're a candidate for hair transplant surgery and undergo the surgery, what should you expect? After a hair transplant, there is a period where the grafts heal and become integrated with the skin. The first week to 2 weeks is characterized by multiple scabs at the sites where the hair grafts were placed. With proper care, the skin heals and the scabs go away. For several weeks afterwards, the scabs are gone and you can feel the short hairs sticking upward. However, it's common to experience temporary loss of the grafts as well as native hairs. This is referred to as shock loss. During this period, you can actually look worse in terms of lack of hair coverage than you did before surgery. At about 1 year, the grafts and surviving native hairs will be seen. Interestingly, people from around the world who've undergone hair transplant surgery find us and inquire about ways to maximize the success of their surgery. I've found that TrichoStem hair regeneration can help people who have had hair transplant done elsewhere between 1 to 3 months after surgery. In my opinion, the treatment helps create an environment under the skin which supports better hair growth. If you think about the amount of trauma to the scalp during surgery, it makes sense that improvement in blood supply and the tissue quality around the hair follicles should be advantageous. One observation I've made for patients who were treated within the first 3 months after hair transplant is earlier hair growth than would be expected. In addition, the improvement in the existing hair in terms of thickness as well as the stimulation of native hair results in overall better coverage, essentially helping the hair transplant look better than it otherwise would have. Another benefit we've seen for people who've had hair transplant in the past is that the quality of the transplanted hair improves after TrichoStem hair regeneration treatment. This has been seen in people who have had their transplants more than 10 years prior, as well as people who've had multiple hair transplant surgeries. Hair loss does not always require hair transplant surgery. The foundation of managing hair loss is to understand that hair transplant is one option in a management strategy. Medical and non-surgical therapy, such as TrichoStem Hair Regeneration, has been a successful alternative to hair transplant surgery, as well as a useful treatment before undergoing hair transplant. In addition, during the first 3 months after hair transplant surgery, TrichoStem Hair Regeneration has even helped optimize results after hair transplant surgery. I hope you found this information helpful. Thank you for your question.